You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Dilger. Dr. Dilger, welcome to the program.
Randy, thank you. Very nice to be here.
Now, we've had you on the show before talking about lasers and gum disease, and today we're talking about dental implants. For people that don't know you, you've been in Oregon for quite some time, I guess always.
I'm born and raised in Oregon. No web feet,
All right.
but I do enjoy the rain. I will admit,
Okay.
I do love the rain up there.
All right. Now, and we're talking about dental implants. But let's talk a little bit about your practice, because it's a unique practice in a way where you're a technology guy. You do microscopic dentistry. You do teeth in a day. I mean, you have all the new stuff.
Maybe it's because of my math background. I've always loved technology. I've always loved electronics, computers, and throughout my career in dentistry, I've always been drawn to the new item.
All right. Now, tooth in a day. You make teeth, crowns, right there. Patients
Absolutely.
could actually watch it being done.
Patients get to watch that. The patients love this. They come in and we prepare the tooth, and then instead of taking an impression, we take a wand, put it in the patient's mouth, and the computer takes a three-dimensional digital X-ray or digital picture of this tooth. It comes up on the computer screen. I then design the restoration, the crown, the inlay, the onlay, whatever it is, and then it's sent to the milling unit, which is about 10 feet away. Okay. And the patients can watch as this milling unit.
Do they watch?
Most of them do.
Is that right? Saves them a couple of trips to the dentist.
Saves them
Something you mentioned. So there's a wand that goes in their mouth, so you don't have to put the goo in your mouth to make a mold or whatever you call it.
For a lot of people will gag on the impression materials, and so this eliminates all the impression material. The wand is about the size of maybe 3 fingers is all it is, and it has a nice little glass lens on there, and so we get great pictures with it.
Now, microscopic dentistry, what is that?
I've been using the microscope for over 10 years at this point in time, and while I have good vision, I can't look in the mouth without the microscope, because the teeth look as big as this table to me.
So what? It just allows you more precision?
It allows me more clarity in diagnosing. It allows me more precision in restoring. It allows the patients to see what's going on, because every microscope is outfitted with a camera and a monitor on the ceiling.
That's rare. I mean, less than probably 2% of dentists in the world are using these scopes.
Probably less than 1%.
Really?
They're very, very rare.
So the dentistry will last longer? I mean,
and the dentistry lasts so much longer because the tooth looks as big as this table, so when there's a cavity right there, I can fill it that size relative to the table. So it's very conservative dentistry, and it will last much longer.
Okay, good. Okay, now we're moving on to dental implants. I guess a very hot topic. One of the newer things in dentistry.
Dental implants have been one of the best things to happen to dentistry because it allows patients to get their tooth back.
So let's begin then, with dental implants, the different categories of patients that you see for dental implants.
Okay. We really have 4 categories, Randy. The first category would be a person that's missing just a single tooth, maybe front tooth, back tooth. Okay. Next category would be the person that's missing multiple teeth, maybe 3, 4 teeth on one side of the mouth.
All right.
Okay. Then we have the patient who has no teeth. These are our denture wearers. Okay. And then we have the patient who has teeth, but they are non-restorable. Their entire mouth, because of gum disease, most likely, is beyond hope. I can't
so they've
even
been
say
told
with the laser.
By their general dentist, your teeth have to go.
They've been told their teeth have to go.
So dentures or dental implants?
Dentures, dental implants, or toothless.
Okay.
That's their choices.
All right. Okay. Well, let's go back to the one tooth. Why would somebody? I mean, what's the advantage? Help me understand. What is the advantage with doing a dental implant over whatever traditional dentistry is offering?
When we're missing one tooth, the choices are to leave it empty, put a partial denture in, put a fixed partial denture or a bridge in. Okay? So if you leave that space empty, you have a 44% chance of losing an adjacent tooth within the next 10 years.
Interesting. Why is that?
Because the teeth
kind of cave in.
Cave in.
Oh, interesting.
They move, and they're difficult to clean. If you put a removable partial denture, they will hold the teeth in position. It will make you be able to chew better, but because of the way it holds onto the teeth and the way it traps food, it actually increases the odds that you're going to lose that tooth within the next 10 years.
Okay.
If you put the fixed partial denture or bridge in, that does a great job. You can chew wonderfully with it. And dentistry has done this primarily for the past 100 years. Okay? They're very successful. They're done very often. The problem comes in is that the bridge, you cannot floss through the middle of the bridge. You have to thread the floss underneath.
Interesting.
Not everybody does that. So the incidence of decay around those adjacent teeth, we call them the abutment teeth, is very, very high.
Do you have to carve down the two teeth
and the
to
two
grip
teeth,
on
the
to
two teeth have to be reduced in size, carved down or prepped, so that when we put the bridge on over those two teeth, it comes up the size that the teeth were originally. And interestingly enough, statistics show that 80% of those teeth that are prepped for a 3-unit bridge have no restoration on them previously, or only a minimal size restoration. So you're taking good, healthy tooth structure and destroying it. Whereas the implant, you put the implant in there and you have a single tooth solution for a single tooth problem.
Now, I looked at the internet. 17 million estimates. 17 million people have either an upper or lower denture. Okay, I guess it always starts with one. Does the dental implant have anything, in your opinion, to do with prevention, future tooth loss?
When we start talking about other ways, what happens when you lose that tooth, increased risk of losing the adjacent teeth. When you put the implant in there, statistically, there's no increase in loss of the adjacent teeth.
Okay, the people that are missing 3 and 4 teeth, and we've talked on the telephone, you say they may be headed for problems if they don't have dental implants. Expand on that.
They are definitely headed for problems. What happens when you're missing that many teeth is you get a much larger shift in the remaining teeth.
So let's say, okay, so 3 or 4 teeth in the back.
3 or 4 teeth
What's
in the
going
back.
on?
And let's talk about bottom teeth.
Okay.
Same, reverse would happen on top. But bottom teeth are missing. As you attempt to chew, the top teeth are slowly growing down. Can even happen to the point where you're actually chewing on the gum tissue on the bottom. You can get a lot of movement on here. Okay? As the top teeth grow down, they're growing out of the bone. You're not able to chew, so you're not getting the normal cleaning action that food gives to the teeth. You're not going to brush and floss. You have bigger spaces between there, so you're going to rapidly lose the upper teeth. The other thing that happens, as you have no teeth to chew on this side, it affects the joint. So the joint starts to collapse. You start to have jaw problems. You start putting more pressure on the front teeth start to wear faster. It's a snowball effect.
So what if you put a bridge or you put something in the back?
So if we're missing 3 or 4 teeth in the back, if we have a tooth back there, we can put a bridge in. We run into all the same problems with the bridge. You
But
can't
if you
clean
don't?
under it. If you don't have a tooth back there, we put a partial denture in. A removable partial denture that snaps in and snaps out. We've done these for more than 100 years.
I know you still probably do them all the time, but your goal is dental implants.
There are patients that choose this for a reason. But what we see is this: you lose the teeth that it's attached to. It doesn't provide as much support to the opposing tooth. They catch a tremendous amount of food. Every time you eat, you have to take this out, you have to rinse it off, you have to rinse your mouth out. They oftentimes will come loose while you're chewing. And the cost, the long-term life of the partial
much more than a dental implant.
Much, much, much more. One estimate is if you have a young person in their 20s, it will cost them as much as $22,000 for the lifetime.
Over
to
time,
maintain
because they
that
don't
partial.
last forever.
They don't last forever.
Okay, so
The
it's
adjacent teeth.
now when I hear terms like you're missing teeth, 3 or 4 teeth, there's a snowball happening in your mouth. That the
Yes,
mouth
there
is
is.
collapsing.
Mouth is
And why
collapsing.
is that? Because you're saying the bone is resorbing, or
Well, the teeth are a system, and as long as everything is there, everything works together. When you take one cog out, it can't run the same. And so the adjacent teeth starts to tip, the opposing teeth starts to lengthen, the other teeth that remain in occlusion are having to take more pressure than they were designed to do.
You know, we're talking about prevention right now. So the people that are watching this right now, missing 4 teeth, and they have a partial denture or whatever, in a way, they're headed for disaster. They're headed for future tooth loss.
They are headed for
So they should
additional
come
tooth
in.
loss.
If they got dental implants, they could stop the process.
Is
that true?
Once you put a dental implant in,
Okay.
you stabilize the mouth in that area. The other thing that's real important, when you miss those 3 or 4 teeth back there, the bone where those teeth were, the body absorbs it.
Okay.
And if you ever see somebody in a nursing home and it looks like they have a piece of spaghetti for a lower jawbone, it's because they've been without teeth down there for many, many years. One of the turning points for me that really opened my eyes on implants was the study that shows when you put an implant in, the body responds the same as a natural tooth. The bone maintains around that implant.
Okay.
That's huge.
All right. Now, denture wearers. Okay. I guess they benefit the most.
They do benefit the most. Denture wearers, every denture wearer that you talk to will remember the first month it was just a huge struggle. They had a hard time getting used to wearing the dentures, talking with the dentures, and eating with the dentures. Then they kind of accommodated to it. But if you look at how they're chewing, they're not chewing the same way they did.
Is that true? It's almost like a cow. They're just kind of rubbing it together.
They're
the
rubbing
food.
it together.
They're not really. They can't tear it, I guess.
I have met a gentleman who could bite an apple with his dentures. Pretty rare. He could bite the apple without his dentures too, though. I mean, he had gum tissue that was rock solid. But for most patients, no, they cannot. They rub their dentures together. They go around. Lettuce is just a tremendously difficult food to eat with dentures. But if we can go in and put implants in, we can stabilize those dentures. You can now open and close and use teeth the way they were designed to be used, and you can actually start to crush and tear food the way you're supposed to.